the hidden reason your legs keep swelling and how to fix it. She is rushing. It is 7:14 in the morning and Linda is already late. She grabs her shoes, the black flats she has worn to work for 3 years, and tries to push her foot in. They don't fit. She tries the other shoe. Same thing. Her ankles are swollen. Not a little puffy. Visibly, undeniably swollen. Linda is 52. She works as a school administrator in Columbus, Ohio. She has no history of heart problems. Her blood pressure is fine. She eats reasonably well. But standing in her bedroom that morning, staring down at feet that no longer fit into her own shoes, she feels something shift. A quiet alarm she cannot explain. She grabs a different pair, a roomier one, and pushes through the day. By evening, the swelling is worse. By the end of the week, it is still there. 3 weeks pass. Then 4. Nothing changes. Her doctor checks her heart, her kidneys, her blood pressure. Everything comes back normal. He hands her a pamphlet. Elevate your legs, stay hydrated, try not to sit too long. Linda does all of it. The swelling doesn't move. What nobody tells her, what most people in this exact situation never hear, is that swollen legs almost never have just one simple cause. The real answer is hidden inside a system most people don't even know exists. A system that runs silently through the body every hour of every day. And when it starts to break down, the legs are always the first to show it. This video follows Linda's story from that Tuesday morning to the moment she finally got a real answer. Along the way, it explains exactly what causes leg swelling, what most doctors miss, and what actually makes a lasting difference. Stay with it. This one matters. The system nobody talks about. Everyone knows about the heart and blood. Blood goes out, carries oxygen, loops back. Clean and simple. But the body has a second system running right alongside it. One that barely gets mentioned in school, rarely comes up at a doctor's appointment, and almost never gets credit for how much it does. It is called the lymphatic system. And, in the most practical sense, it is the body's drain. Here is what it does. Every day, the heart pushes roughly 20 liters of fluid into the body's tissues through tiny capillaries. About 17 liters get pulled back into the bloodstream automatically, but 3 liters are left behind, sitting in the spaces between cells, carrying proteins, waste, and immune particles. The lymphatic system collects all of that fluid and carries it back toward the heart through a web of thin vessels and small filtering stations called lymph nodes. Here is the critical difference between the two systems. The blood has the heart, a powerful, tireless pump. The lymphatic system has nothing like that. It runs on muscle movement, breathing, and the gentle pressure of surrounding tissue. The moment a person stops moving, the lymphatic system slows. When it slows long enough, fluid builds up in the tissues. And because of gravity, it always builds up in the same place first, the lower legs and ankles. That fluid buildup has a medical name, edema. But edema is not a disease. It is a symptom. It is the body sending a signal that the drain is struggling. The real job, the job Linda's first doctor never did, is to find out why. 5 things hiding in plain sight. When Linda described her swelling to her doctor, his first instinct was to rule out the serious stuff: heart failure, kidney disease. Those were the right instincts. But they came back clear. What he didn't look for were the quieter causes. The ones that don't show up on a standard blood panel. The ones that affect millions of people and almost never get named. The first is chronic inflammation, when the body is in a long-term state of low-grade inflammation from a poor diet, excess weight, ongoing stress, or environmental exposure. The walls of the tiny capillaries become more permeable than they should be. They leak. More fluid than normal escapes into the surrounding tissue. The lymphatic system, already managing its daily load, cannot keep up. The swelling comes and goes without any clear reason. Most people blame the heat, the salt, or their age. Inflammation is rarely on the list. The second cause is sitting. It sounds too simple to be the answer, but it often is. The calf muscles are the primary pump for lymph fluid in the legs. When someone sits for 6, 7, or 8 hours with minimal movement, as Linda did every day in her office, those muscles do almost nothing. The fluid stagnates. The legs grow heavy. This is why so many desk workers start developing swelling in their 40s with no other explanation. The body needs movement to drain itself. The third cause is low protein. Protein in the blood creates a kind of osmotic pressure that holds fluid inside the vessels where it belongs. When protein levels fall, from undereating, extreme diets, poor gut absorption, or simply aging, that pressure drops and fluid leaks out more easily. Deficiencies in magnesium and B vitamins can also impair how well the lymphatic system functions. The fourth cause is medication. At the Cleveland Clinic in Ohio, vascular specialists regularly see patients who spent months confused about persistent swelling, only to discover a single drug was causing it. Amlodipine, a calcium channel blocker, commonly prescribed for blood pressure, is one of the most frequent pharmaceutical causes of leg edema. Hormonal medications, steroids, and even routine use of ibuprofen can all cause the kidneys to hold onto extra fluid. The swelling gets blamed on aging. The real cause is in the medicine cabinet. Linda had 2 of these happening at once. 11 years of sitting at a desk, and early venous insufficiency in her left leg that no one had ever tested for. Either one alone might have been manageable. Together, they were too much for her lymphatic system to handle. Before the solutions, if any of those 5 causes just clicked into place, if someone watching this right now is thinking that sounds like me, please take 1 second and hit the like button. It is a small thing that helps this kind of honest, no-filler health content reach more people who are sitting at home with swollen legs and no real answers. And drop a comment below. How long has the swelling been going on? What has been tried? What has helped? Every comment builds this community, and someone else's story might be the thing that finally helps another person figure this out. Now, here is what Linda actually did to fix it.